National Newborn Care Week is celebrated every year in the country from 15th to 21st November. Every year, 26 lakh babies die in the first 28 days of life, most in the first week. And 75% of newborn death can be prevented with just few effective health measures provided at birth and during first week of life. In this regard, Withstand Fitness wants to create awareness and hence we invite our esteemed guest, Dr. Rupal Dalal, to share her valuable experience with us. Dr. Rupal Dalal is an experienced pediatric doctor. She is also the Director of Health and Nutrition at SMDT, Maharastra. Dr. Rupal Dalal is also an adjunct faculty at IIT Bombay, and it was from there that our association started as I was a student of Dr. Rupal. So, Dr. Rupal, thank you for joining for today's session. Welcome to the session. I would like to start this session with a very valid question like, what do pregnant mothers need to know before and during child delivery?
So, first of all, I must tell you the importance of first 1,000 days. Okay, first 1,000 days, which starts from conception of the baby. Okay, and it continues till second birthday of the child. Okay, the reason this particular first 1,000 days is very, very important because the maximum amount of growth occurs in first 1,000 days. Okay, so growth includes your height, like height of a child. Okay, and also brain development. Okay, so those two things are very, very important in child's growth and development because if you don't have good height because of poor nutrition, and if you don't have poor if you have poor nutrition, then it will affect your mental IQ also, brain IQ, right? So that's why it is very, very important, and specifically it is important during pregnancy and first 1 year of life. Okay, so pregnant mothers have to be very, very vigilant about her own nutrition, her mental health, her physical health, exercise, understanding how babies breastfeed. So, and what are the options of feeding the child? Okay, and then what happens during delivery and what happens post-delivery. So these are important points that mothers need to understand. Very, very important is the nutrition. Because imagine the baby is being formed, right, in the womb, and she needs to understand that what all nutrients that she needs to eat in the form of food, which will not only make a baby's muscle mass, it will improve baby's growth. In a sense, baby will be tall when baby is born, and then you want perfectly manufactured organs, right? Because baby is being manufactured during this time, in first 9 months, in the 9 months of pregnancy, right? So that understanding of growth or understanding of nutrition starts from even before pregnancy, actually. Okay, and once you conceive, then you want to definitely improve your protein intake. Okay, and then other nutrient like your calcium intake. I'm talking about from food. Okay, food. Through food, I'm talking about nutrition through food, and then also folate, zinc, B12, choline. There are like about 40 nutrients, iron, good fats, which is important for baby's growth, baby's brain actually. So that is your nutrition aspect. Exercise is also very important. They can join yoga, they can join, as you guys know, but I won't go too much in detail, but that exercise during pregnancy is also as important. Mental health is very important. Mental health, now a lot of research is coming out that if mothers eat a good nutritious diet, and if she's in a good environment, it will improve her mental health also. And the last trimester, I would recommend in the last month of pregnancy, mother has to know importance of breastfeeding. Okay, that breastfeeding is actually recommended by WHO, where as soon as baby is born, baby is put on mother's tummy and the baby crawl to baby's mother's breast, and then they start suckling. Okay, so that phase is very, very important. Skin to skin contact immediately after birth is very important. Now, if mothers don't know this, And if they don't demand from doctors, doctors will not do it. There is still, they take babies in a separate room, they give formulas, they give other milk, cow's milk, that will affect baby's gut microbiome. Okay, microbiome which are present in baby's gut, and baby will be prone for a lot of infection, and this would be lifelong problem. Okay, so this one thing that she needs to know, like what is breast crawl. It can be done during cesarean section also. So it's not only for normal delivery. It's they can do it in cesarean. And also another thing what she needs to know is breastfeeding skills, because what most of the mothers are struggling with is proper skill during immediately after birth. Okay, so she needs to know. I prefer cross cradle hold because it has given amazing results. But the cross cradle technique, okay, and then basically there are 45 points. So those 45 points are important to understand. She can also buy a baby doll and a breast model, then she can practice. Okay, so that way once baby comes out, then she knows how to do it. Okay, but she will need support from nurses also. So it's important that she send this information to nurses also, so they can also learn. Okay, but it's only not only just mother need to learn this skill. I think even if husband can learn, other family members like mother-in-law, sister-in-law, they can learn, they can support her. So those are a few points that she needs to learn. There are other points that she may need to read, like how to give a bath, when to give bath, what are other issues that she can face, with the baby, what happens when there's minor cold, congestion, what to do at home. So those are minor things, but the main thing is infant feeding. Okay, so if she's prepared, she'll be able to fight that war in the battlefield. So I call that post-delivery as a hospital as a battlefield. Okay, there'll be so many issues, and then there won't be much support for her. So she has to prepare herself. Okay.
So, ma'am, I would like to ask that there are so many mothers now who are giving formulas to the kid. So, any suggestions or any insights on that? Like, is it right, or what exactly should happen with, like, in this case?
There is definitely issue of giving formulas, and that issue starts actually from the hospital itself. Okay, because hospital staff, hospital doctors, they're not trained in breastfeeding skills, correct breastfeeding skills I'm talking about, and that's why they start formulas. Okay, so and then there are a lot of myths among doctors that mother is not getting enough milk, or mother is tired, or this is cesarean baby, so mother will not get milk. So there are so many myths. Plus, they don't start a baby on breast milk within 1 hour. So if you don't start breast milk within 1 hour, then the risk of developing, low sugar in the baby and other issues are much higher. Okay, so that's why I feel that. And one more thing is that they're using right now something called cradle hold. Cradle hold is a traditional hold where suppose you're feeding the baby from left side, so you keep the baby on left side only. The head would be on the left side. Okay, and you're holding the baby with the same hand. And this cradle hold has some loopholes. It has some issues, and babies are not gaining adequate weight. Okay, so what I recommend is to, like mother should and the whole family should learn cross cradle hold. Okay, in cross cradle hold, what happens is basically mother is holding the baby from the other hand, opposite hand. Okay, so suppose mother is feeding the baby on left hand side, so she will hold the baby with the right hand. Okay, and this way you can maneuver baby's head like front and back. So that way, for example, if we drink water, we always lift our neck a little bit higher up, right? And similarly, if she can bring the baby in a such a way that she's keeping the baby's head a little bit extended, so then it will be easy for baby to swallow. So it's much easier when she holds the baby from the other side. Okay, and another issue which we see all the time in cradle hold, that most of these babies are only nipple latching. They're just latching on the nipple. Okay, so then and in nipple there is you don't get milk while just pressing the nipple. Because all the ducts which has milk are present in the black part of areola, around under the black part. So it's important that mothers wait till baby opens a big mouth, almost 120 degree, and then put the lower part of the areola in the mouth. When we eat, we put anything which is close to our lower lip, not upper lip. right? So here, again, all this thing is very easily maneuverable in a cross-field technique. So, like in my opinion, most of the mothers fail because of the improper hold. 3 or 4 things are happening. One thing is baby's only nipple latching; they're not waiting for the baby to open the mouth. Second thing is, in this position, baby's head is flexed like this. Okay, so when you have a flexed head, you won't be able to swallow. Just like how we would drink water, if you have this kind of neck, you won't be able to swallow at all. So you want to, this are all points which mothers need to know during pregnancy. Okay, so she don't make this mistake. Now, and third thing is that, because baby is this way, mouth will be too far away from the breast, so baby doesn't have proper grasp. Okay, and then there is more of upper areola going in the mouth rather than lower areola going in the mouth. So this are all few things. And one more thing, what I've noticed that, first for 24 hours, babies sleep a lot. So they don't wake up the baby. They just let baby sleep. And by the time baby is ready to feed, baby is already so low on sugar, So it's important that mothers breastfeed very frequently in first 24 to 48 hours, because more she feeds, more faster she will get. Okay. In first day, she gets colostrum. She gets colostrum first 2 days, but the quantity is less because baby's stomach is small. It's small. Okay, so that's what she wants to do. And another thing, what she can do is to learn how to express breast milk. Okay, she can do manual expression, and it has a different technique to it. Just by pressing areola will not bring the breast milk out. What you'll have to do is to press, compress, release. So that we have shown in our tutorial how to do that PCR press, compress, release, and that way she can remove milk and give the milk in the spoon. Of course, that happens when baby is not latching on properly. But the first point is that she has to latch on the baby. So if she does this, then she won't have any complication like nipple sore or breast abscess or breast sore. She will not feel that I'm not getting enough milk. Because more she feeds, earlier she feeds, and effectively baby feeds, then she will definitely get breast milk. There's no doubt about it. Okay. And if somebody says, give water, give formula, give this, you have to put your foot down and say, no, I will give my own milk. Okay, because there are a lot of it's a formula making company has $75 billion turnover. Okay, so why would anybody would want mother to breastfeed a baby, right? That's a loss for them, right? So you have to make them understand. They can also know about IMS Act. So we have something called IMS Act, Infant Milk Substitute Act. Okay, so there are 10 rules for that. So if anybody violates one of those 10 rules, they can go in the jail. Okay, so this is to protect mothers from predators. There are predators, right? So to undermine the confidence of mothers' capacity to breastfeed. Okay,
the engineering institute, role of engineering institute like IIT Bombay in this. And then we can also talk about like the work that you are doing presently in India. So on that also we can have a short.
Yeah, 14 years or so. In California, one of the most developed state in US, right? So and it was Silicon Valley. So again, hub of your software engineers. Even there also, there was a lot of issue with breastfeeding. There's no doubt. But when I came back to India, I joined one college. It was a pediatric hospital, charitable hospital in Mumbai, and I wanted to see what are the diseases which are prevalent in Indian children, because I had not studied here. My pediatric was done in US, right? So when I entered that hospital, I saw huge wards with 100 children in one ward. Okay, like I've never seen that in America. We would have one room and one child, right?
Yes.
Like one big room but 100 children. Plus, they did not have a facility like CR monitor, cardiorespiratory monitor. They didn't have pulse ox. They didn't have proper oxygen. They didn't have proper suction machine. So I saw all this like very kuposhit, very malnourished children dying of diarrhea and pneumonia, which is unheard of in America. First of all, babies are not malnourished, and then when they get diarrhea and pneumonia, they immediately get better, and we don't need to, even if we need to use infrastructure, we have very strong, amazing infrastructure in America, right? Developed world. When I came in India, this is completely opposite. It was completely opposite. Children were malnourished. They didn't have enough infrastructure. So this is a reason that I decided to work in India in a community, because what would happen if we would make these children healthy, okay, in the community, they would not get diarrhea and pneumonia, and they would not then come to hospital to die. So this is how I started working in community. In community, what I saw that all these children were very, very malnourished. Okay, in slums of Mumbai, extremely malnourished. And again, because my training was not on nutrition at all, it was in pediatric medicine, right? On machines and all that. So it was. I came with a clean slate, with clean mind. Okay, and when I worked there, I realized what are the loopholes, because first 4-5 years I did not see results. There were no results. I did not see whatever guideline was there. I was reading the guideline telling them that babies are not gaining weight. And that's when we came up with second technique, which is recommended by WHO, which is cross-cradle hold. So we improvised the technique. Okay, so once we improvised the technique, once we understood a nutrition aspect of older children, we prepared some recipes for powders which mothers could make it at home, and they could put it in children's food while cooking. Again, we started seeing beautiful growth. And we presented our data in World Breastfeeding conferences and other places. And as soon as that happened in 2017, one of the professor of Spoken Tutorial Project, Spoken Tutorial Project, Professor Kanan Mogdale, he came and he said that why don't you basically help us with the content, okay? Because they wanted to make tutorials on health aspect, health and nutrition. So far they were making it for software engineers, but now they wanted to make it for just Anganwadi and Asha workers on this aspect. And this is how basically I joined IIT Bombay. Sitara, I joined faculty in 2019, because many students from Sitara, they were working on food and nutrition, and they would come home through Professor Shah, Narendra Shah, to learn about nutrition and learn about all these different both nutrient and malnutrition and all. And then many of them would come home, and I would even talk to them about not just nutrition aspect, but also breastfeeding. And so Professor Agnihotri, he said that why don't you just come to IIT Bombay rather than students coming to your house, come to IIT Bombay to give lectures. So that's how I joined as Adjunct Faculty. Okay. And so what we are doing now in IIT Bombay, through Health Spoken Tutorial, we have created so far we have 95 tutorials, okay, 95 topics. And these are only basically nutrition related tutorials, basically through life cycle approach. So we have adolescent nutrition, pre-pregnancy nutrition, pregnant and lactating mothers nutrition, in breastfeeding tutorials. We have about 20 breastfeeding tutorials, skills and importance, and if there are issues. Okay, so a very problem focused tutorial. And then we have tutorials on complementary feeding also. So after 6 months, when mothers start, complementary feeding, what food to start, how much to start, how to give it. If newborn has an issue, like if mothers want to know how to bathe the baby or how to put the diaper on, all that, like all basic care that mothers need to know. And then we have created this tutorial into 15 different languages, not just English. It's there in all the local languages, and now we're creating it into tribal languages also. Okay, so now we have almost 5 to 6 tribal languages, because if we can teach these tribal mothers using our tutorial, they will know much more than doctors. Believe me, doctors have no knowledge on this. So this is what
there is a lot of death even with the tribal communities. So for them, malnourishment is a big problem. So I think this will help them a lot if it is converted into their language.
Absolutely. IIT Bombay. Second thing is Professor Satish Agnihotri. He works with data analysis. So we get data from all over India. So our students, they analyze data. They make it visualization very good. So that's how they work on data analysis also. We have Professor Amit Arora. He works on different aspects of like food processing, creating recipes, creating kind of good composition of food products. So he's working on that. So we have like whole team who's working on child malnutrition, not only child but adult nutrition also.
Like about the mothers, how do mothers can have a better recovery post pregnancy and that, like not just physical but mental and wholesome recovery after pregnancy?
The biggest fear that mothers have, whether she'll be able to breastfeed her baby or not. Okay? So one thing, if she learns properly, she will have that stress over. Okay, baby's gaining weight, she'll be very happy. Otherwise, she'll feel a failure as a mother, right? Second thing is her own nutrition. Because she'll be so tired, every 2 hours she'll be feeding the baby, right? So that she has to take care of her sleep, she has to take care of nutrition and hydration. Okay, so she'll have to drink at least 8 to 10 glasses of water. Okay, but just before breastfeeding, she will have to take a nap every time baby is sleeping. Just ask anybody else to burp the baby after the feeding. She should not do all that. She has to only breastfeed and that's it, done. Okay, and then as soon as baby sleeps, she has to sleep. So it has to be, if taking a nap for 1 hour, she has to take a nap, because otherwise, it's very tiring to keep waking up, and this goes on for a good 1 year. Almost 9 months to 1 year, right? So the sleep, when you're sleep deprived, it affects mental health also. Okay. Another thing is that people around her has to be very, very supportive, because if they are not supportive, they will, she won't feel good. So husband has to be very supportive. Mother-in-law, and that's why in our culture, girls, they go to mother's house, right? Because at least 3 months they had mother support. She can shout at mother, she can't shout at mother-in-law. So she has to express herself. If anything is wrong, you ask her. Ask her what is wrong, why are you upset, all that. She will, if there is no, because what happens when the baby is born now, everybody's attention is on the baby. Did baby eat? Did baby do this? Because while she was pregnant, the attention was on her. Right? Now when the baby is delivered, all attention goes away from the mother and then it directly goes on the baby. The mother feels it's like they feel very abandoned, I feel, which is not right. So we have to tell family before, during pregnancy only, that it's mother and baby both. You can't forget mothers and babies when babies are born. That's it. I think that's important.
The breastfeeding part. What other things mothers should care about with a newborn, with respect to hygiene and sanitation? What all they should keep in mind?
The main thing is that you want to definitely wash hands before taking up the baby for breastfeeding. Okay, so that washing hands with soap and water is very, very important. Second thing is that many times she has to know when to breastfeed. Because a lot of time they feel that when baby cries, that's when I'll breastfeed. So she has to know what early hunger cues are. That's important, because then what happens? Babies don't cry much. When they don't cry much, mother will be able to produce more milk. They will be able to latch on very well when baby is not agitated. So those minor points that she has to know beforehand is part of 45 points. Okay. Third thing is she has to understand there are different cries. Okay, different cries. Some babies cry when they're hungry. Some babies cry when they are wet. Some babies cry when they're cold. Some babies they cry when they are warm. So she'll have to learn a lot of those different cries. Okay. Another thing is that her diet. So very important, because she's producing milk, right? So she has to eat food which is high in protein. Good fats. Avoid sugar, jaggery. Avoid a lot of this carbs, refined carbs, ultra-processed food. Don't take those, protein mix that you get, in the market. Basically, homemade food is important. Baby may get some rash. These are minor rash, normal rash. So if mothers know about those rashes, she should know about her diaper. I don't recommend plastic diapers, to be frank. Especially in India, because it's so hot. So cloth diapers are definitely better. How to wipe children, that's also important to avoid a lot of this chemical wipes. In America, everybody uses those chemical wipes, but we see a lot of problems in that area. So you want to just use maybe cotton and then just wet it and just kind of wipe it. Okay, and pretty much that's it. Basically, newborn care. Bathing clothes also. You don't want to wrap the baby too much. Because people have this habit of putting 2-3 layers of clothes, then they put 2 layers of blanket, and then cap, then mitten and everything, that too in the hot weather. So, please do not do that. Just make baby wear extra 1 layer, that's it. Okay, and 1 cotton blanket. Okay, always make sure that baby is put in a sleeping position, a supine position, means back on the back, not on the tummy. Very important, because there is something called SIDS, sudden infant death syndrome, which is more common in babies who sleep on the tummy. Okay, so make sure that, and you don't need to use pillows, or you don't need to use some as a blanket. Don't make them wear blanket. You can wrap it, but not too tight. Not too tight, because you don't want hips to be very tight. Hips should be movable. Okay, otherwise they can get a bit kind of dysplasia. Okay, so those are some important points that she needs to remember. And there is a very good tutorial on how to bathe the baby also. What should be the temperature of the water, how to bathe the baby in different environment. So they can watch that tutorial. It's about 10 minutes. Okay, so that's it.
In what way the breastfeeding boosts the immunity of a child? Like, what is the benefit of the mother's milk for the child?
There's such innumerable benefits to baby. What to say? It's just amazing. Everything. It helps with everything. It is the best food, nature's food that baby can get, and it's baby's right. Okay, very important. It has passive immunity immunoglobulin also, like IgA, IgE, all these different immunoglobulins are part of breast milk. So it protects baby immediately. Babies who are breastfed right away, they have very less risk of getting infection, less risk of diarrhea, pneumonia, less risk of getting jaundice. These babies don't get jaundice as much. Risk of low sugar goes down, like hypoglycemia we call it. Okay, they also protect against cancer. It protects against metabolic disorders in babies, like when they grow up. So these babies have less risk of getting diabetes and blood pressure. Okay, less risk of asthma, like allergies, asthma. A lot of other celiac disease also. Less risk of celiac disease. It is helpful for mothers also, not just for babies. Okay, so it definitely reduces postpartum depression. It kind of protects mothers against breast cancer and ovarian cancer also. It protects mothers against metabolic disorders, against obesity. So it just on and on and on and on. Again, we have created amazing tutorial. One is on importance of breastfeeding, another one is on complications of formulas. So if mothers can watch it, it's much more in detail. Okay? But it has everything that baby needs, everything. One thing they need to remember, that they have to empty the breast completely from one side and then put on the other side, because the back part of the milk, it's very high in fat, which is important for IQ. Okay, so if you want baby to be Einstein, make sure that mother feeds the back part, the thick part. Okay, because that will increase the IQ of the baby. Okay.
Yeah, and ma'am, also needed to ask you about, there are now a lot of cases where children are adopted, and there are even surrogate mothers also. So in their cases, how they should deal with breastfeeding?
So there are, if you're planning to surrogate the baby, and if you know it beforehand, you can approach lactation consultant, and they can start kind of induction of lactation, and so there is a whole process to it. So they can be put on hormones. They can start kind of producing milk even before baby arrives. Okay, so and there are special lactation consultants for this, so they can contact this lactation consultant and they can help. Okay, but yes, of course, mothers can breastfeed even if baby is not born through her womb. She can breastfeed provided she comes at time early before baby arrives. Even after baby arrives, we can do it, but it just takes a little bit longer. But if she's already if she knows that in December baby is going to arrive, she can approach 6 months before. So that way we can induce lactation. Okay, so that's important. And suppose if she can't lactate, if there is an issue of lactation, I prefer that children are given cow's milk rather than formula. So full cow's milk, no dilution, okay, because that is less ultra processed. It doesn't have sugar, it doesn't have all this emulsifier, it doesn't have all these chemicals. So I prefer that they get cow milk rather than get buying formula.
I think all our audience will be really very happy to know about all these facts, and I'm sure many must not be knowing the technicalities of it. So thank you so much for joining us, and wishing you all the best in this journey, and you're doing a great work. So wishing you, and we'll also be putting your links of the voice tutorial we'll put on our description box, and we'll let people, more of our customers and everybody, to know about
it's for the best. Okay, all the best, and not to forget to subscribe to Health Spoken Tutorial channel, IIT Bombay. Okay, YouTube. Again, it's totally, and it's also for adults. So it's not only for mothers and babies. It's also for adult nutrition. It's all low carb recipes that we have created. No sugar, jaggery, wheat, rice. Okay, and it's all we have gone deep into each nutrient that is required for our body, and then make 2 tutorials on one veg recipes and one non-veg recipe. So everybody who is into fitness, that definitely they always think of what to eat, right? So do pass on to just anybody.